Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Endocrine medications. A patient adrenal insufficiency is to be discharged and is given prednisone as a home medication. The nurse instruct the patient the following, except Option A. To avoid aspirin-containing products. Option B. To avoid foods rich in potassium. Option C. To avoid caffeinated drinks. Option D. To avoid individuals with respiratory infections. Right answer is Option B. To avoid foods rich in potassium. One of the side effects of taking prednisone is hypokalemia, so a potassium-rich food should be included in the diet. Sildenafil, Viagra, is given to a patient with erectile dysfunction. Which of the following history is contraindicated with the medication? Option A. Blurred vision. Option B. Neuralgia. Option C. Use of vitamins. Option D. Use of nitroprusside. Right answer is Option D. Use of nitroprusside. Sildenafil, Viagra, are contraindicated in patients taking nitrates, nitroprusside, and beta blockers. Options A and B are the side effects of this medication. Option C is not contraindicated with the use of sildenafil. Glipizide, Glucotrol, is prescribed to a patient with diabetes mellitus. The nurse instructs the patient to avoid which of the following? Option A. Soft drinks. Option B. Oatmeal. Option C. Alcohol. Option D. Organ meats. Right answer is Option C. Alcohol. Alcohol, when combined with glipizide, a disulfiram-like reaction, flushing, headache, and nausea, happens. In addition, large amounts of alcohol cause hypoglycemia. Options A, B, and D are not to be avoided. A nurse is teaching a patient on how to mix regular insulin and NPH insulin in the same syringe. Which of the following actions, if performed by the patient, indicates the need for further teaching? Option A. Withdraws regular insulin first. Option B. Withdraws NPH insulin first. Option C. Injects an amount of air equivalent to the desired dose of insulin. Option D. Injects air into the NPH insulin first. Right answer is Option B. Withdraws NPH insulin first. The regular insulin is drawn into the syringe first, then the NPH. This will avoid contaminating the regular insulin vial with another type. Options A, C, and D are correct actions for preparing regular and NPH insulin. A patient is taking insulin glargine injection daily. The nurse instructs the client that the onset of action will likely happen. Option A, 2 to 4 hours after administration. Option B, 4 to 12 hours after administration. Option C, 6 to 12 hours after administration. Option D, 18 to 24 hours after administration. Right answer is Option A, 2 to 4 hours after administration. Insulin glargine is a long-acting insulin with an onset of 2 to 4 hours, no peak, and its duration of action is 24 hours. A private nurse visits a client who is taking Humulin NPH insulin daily. The client asks the nurse on how is the storage of the unopened vials of insulin. The nurse tells the client to Option A. Store it at room temperature. Option B. Store it in the freezer. Option C. Store it in the refrigerator. Option D. Keep the insulin in a sunlight, dry place. Right answer is Option C. Store it in the refrigerator. Unopened insulin is stored in the refrigerator until the expiry date. Option A. Only opened vials are stored at room temperature and it will only last for 28 days. Option B. It should never be stored in the freezer. Option D. Insulin are sensitive to light. A client with diabetes mellitus type I was prescribed with exenatide, Bydureon. The nurse will take which of the following appropriate actions? Option A. Withdraw the insulin from the pre-filled pen into an insulin syringe. Option B. Monitor for signs of nausea, vomiting, and gastric upset. Option C. Administer the medication twice a day during pre-meals. Option D. Hold the medication and call the physician to question the prescription. Right answer is Option D. Hold the medication and call the physician to question the prescription. Exenatide, Bydureon, is only used to treat diabetes mellitus type 2 only. Therefore, holding the medication and calling the physician to question the order. Option A. Pre-filled pens are ready for injection. Options B and C, although are correct about the medication, it should not be administered in this kind of situation. Which of the following insulin cannot be mixed with any other type of insulin? Option A. Insulin glargine. Option B. Insulin aspart. Option C. Insulin isophane. Option D. Insulin lispro. Right answer is Option A. Insulin glargine. Only insulin glargine cannot be mixed with any other types of insulin. Which of the following medications causes hypoglycemia, except? Option A. Salicylates. Option B. Oral contraceptives. Option C. Sulfonamides. Option D. Anticoagulants. Right answer is Option B. Oral contraceptives. Medications such as thiazide diuretics, corticosteroids, oral contraceptives, estrogen, and sympathomimetics cause hyperglycemia. A nurse is providing instruction to a client who is prescribed with repaglinide, Prandin, all of which is true regarding this medication, except Option A. Do not skip the dose when a meal is not taken. Option B. Dizziness may occur while taking it. Option C. Has quicker and shorter duration of action. Option D. Used to treat type 2 diabetes mellitus. Right answer is Option A. Do not skip the dose when a meal is not taken. Repaglinide, Prandin, is a meglitide type of anti-diabetic which has a quick onset of action which allows a client to take the medication with meals and skip a dose when a meal is skipped. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.